We have here today with us Damon Harbison from SSM Health St. Mary's Hospital here in Centralia. We had talked before about trying to give an update from our local hospital on what's going on with the coronavirus, the COVID-19 situation. So Damon, how are you doing?
Doing great. Like much of the population, concerned about what we're going through, very unprecedented times. And, I just appreciate the opportunity and the request to speak at the luncheon. I am so sorry that we're not doing this live, but I'm sure with Marcus's mad editing skills, this will turn out perfect. I had another commitment at the same exact time on Wednesday at noon. So I do appreciate the technology being available so that we can do this and I can update you.
Basically, what are the trends? What are you seeing happening right now?
So I think when we talk about our region or our hospital or our town, you also need to know what's going on within at least the region, let's say the bi-state. So I'll talk a little bit about Missouri and Illinois and how that will relate to us here. So in Illinois, there's been 575,000 cases, 11,179 deaths. As of 11/15, new cases that day was 10,636. And we've seen 10 days in a row of 10,000 or more positive cases within Illinois. And then that day on 11/15, there were 72 new deaths. So just kind of put it in perspective per day. And if you rewind in the spring when Chicago was having their first wave of surge, but we were not, the state itself was at about 2,000, 3,000, and then, on a daily. Now we're seeing over 10,000 a day. So it does, alarms do go off, red flags are going up, and to make sure that we have enough resources around us to be able to take care of the community. In Missouri, they're a bit behind us on the number of positive, but their graph looks exactly like ours, where, they were doing about 1,000 a day, and then whammo, they're up to 4,000, 5,000, 6,000. And, in Illinois, we were at that 3,000 zone, and then October come, and the graph just goes straight up. So we're seeing, like I said, in a 10-day period, 10 days in a row of over 10,000 positive. So definitely something to keep in mind. In our region, so Region 5, we have an R naught value, which is a fancy way to say reproductive. So if one person gets it, what is it times for the reproduction? And so we're at 1.8, which is extremely high. Anything over 1 is something to be concerned about. That puts us in a red level. And if you want to think, well, what does that mean? Well, it's rapidly spreading. And so it's the highest. It's rapidly spreading. So at 1.8, and that's in our region. If you want to look at Jefferson County, our close neighbors, they had, and this is as of 11/12. This is not live data, so this is last Thursdays, and by the time you watch this video, it's almost going to be a week old. But they were at a 10.2% daily and a 14.3% positivity 7-day rolling. If you want to drill that down to it, Marion County, where we're at, that's a 20.1% positivity daily rate and a 7-day rolling average of 16.6. So what that tells me is that 7-day average is going to continue to climb because our daily rate is above what we were normally seeing in a 7-day. And then at the Region 5, which what we both sit, is a 12.4% daily positive and a rolling average for a week of 14. So again, you're going to start to see that 7-day go up, unfortunately. Okay, so let's hone in on our sweet community of Centralia and St. Mary's Hospital. We definitely serve more than Marion County. However, we are in Centralia, so I wanted to kind of give a more detailed version. At St. Mary's, we have been preparing for this for quite a while, even before COVID was a thing. We're always working on emergency preparedness, preparing for a pandemic or a tornado or whatever the case may be. So this is not out of the realm. What is out of the realm is you're always preparing for those resources. And then when it's here, it's live, right? It's not a tabletop exercise. It's not a simulation in the ED. This is real live stuff. So what we're doing right now is starting to enact some of the surge plans that we have developed, whether that's a team model for nursing to cohort the COVID positive patients, or the what we call PUIs, if they haven't got a positive result yet, patients under investigation. So we've been doing that for quite some time. And then we want to make sure next that we have enough negative pressure rooms, because we want to keep those individuals isolated, not just with the PPE that you hear about on the news or see on TV, but also the airflow. We do not want the airflow to get out into the rest of the hospital so others could possibly get sick. We want that vented, filtered and vented straight out. And that's what they call negative pressure. So there's negative pressure within that room. We currently have 37 of those negative pressure rooms here at St. Mary's. And this week we'll be adding an additional 10, where we'll take a wing of the hospital and with some help of some local contractors and plant operations here at the hospital, we'll convert another 10. We do about 2 to 3 rooms per day to get that done. So in a week, we should have 10 more. That work starts Wednesday of this week. So we're in preparation for even more surge. I think the most concerning thing is we're all human, right? The doctors, the providers, the nurses, the lab techs, the respiratory therapists, we're all human, and we're out in the community too. So much like everyone else, we're exposed to the virus, and our families are exposed, whether your kids are at school or husband or wife's at work, whatever the case is, we're all in the same pool here. And so our concern is, do we have enough staff and physicians and so on and so forth in each of these areas to take care of the patients that are surging into our hospital, whether that's the ED, the OR, the ICU, the regular floors, telemetry. We just want to make sure that we are covered. And so, of course, we have been promoting, and we'll talk more about it and how you can help section, but of the social distancing and wearing a mask and good hand hygiene and lowering the gathering rate. But what I'm getting at is we're also in the same boat as every other business in town, in the country, right? We have humans working for us, and they are able and susceptible to get sick themselves. So will we have enough staff to cover, right? And so we want to make sure that we're not running at 100% capacity. Thus far, we've been having about 3 meetings a day for availability, both not only on infrastructure and negative pressure rooms, let's say, but also the staff that takes care of these patients. And so we want to make sure that they're healthy, and not only just physically, but also mentally and spiritually. This takes a toll. I mean, this is just ongoing. It's almost been a year of this now. I heard a great phrase: we're no longer your frontline defense at the hospital or your last line, and that's very powerful. But if you can imagine the weight on a nurse on the floor with that, or am I going to take something home to my family? Or is my family bringing something home to me? I mean, it goes both ways. It's a two-way street. But we just thank every individual that works for us, and we try to celebrate them, no matter if it's a big celebration and achievement or something small. We just want them to know how great they are, and they are truly heroes. So that's good. The next thing that we look at is the tools that we treat COVID patients with. One of them, more of extreme, would be ventilators. So within the region, we have quite a few. We have over 25, probably close to 30 now. At St. Mary's, we have 9 total. We've got 4 of those in use, so we have 5 available. But that's kind of that high level treatment for COVID. Right now, we're doing a lot of BiPAP machines, which is less invasive than a ventilator. We have 13 of those. We've got 6 of those currently in use, so we have 7 available. And like I said, in the market, with our sister hospital at Good Sam, they have an ample supply as well. It's really about being prepared. And what tipping point is it when during the surge, which we think it's probably going to be that first week in December, because everything that we're seeing right now in the surge, and today is the 16th, and you're watching this video on the 18th, these individuals that we're taking care of have been exposed to the virus and caught the virus 7 to 14 days in the past, right? And so you start to kind of look back and say, what were we doing 2 weeks ago? And so if you think about that first week in December, you're thinking, oh, Thanksgiving, right? You've got everything that we're surging now. Add on some Thanksgiving family gatherings, because we all miss our family and we are so tired and exhausted, and nothing makes us more comfortable than family and friends. But I beg you to keep those small and intimate, and an immediate household would be even the best. But we understand that we're also human with that. So we think the peak of the surge is probably going to be that first week in December. There's several modeling factors that people a lot smarter than you and me, Marcus, are in rooms with big computers figuring that out, and just on the slope of what's happening, the positivity rate, and then, like I said, the family gathering just with the holidays and things. Just a fact, our express clinics, we've got one in Mount Vernon and one in Centralia. The one in Centralia, we got back information back. In the last 72 hours, we had 83 positives. Those are just the ones that we know about, right? And the Marion County probably has more than that because they've got other testing sites within the region. But just to show you, like, that's 1 hour over the weekend. So that's a pretty powerful message. I look for things like that would just get people to think, like, graphs and data and things that I don't want to scare, but like we're looking at facts.
Well, and I think you're hitting on a point too, that this is coming close to home. I think we all know somebody that has been quarantined or has tested positive, even if they've been asymptomatic or have mild symptoms and they have not been hospitalized. And so I think the fear there is that this is really close to home. So what can we do to keep the spread down? I think that you touched on some of that, but so what can we do as individuals? What can we do as businesses?
Sure. So what we can do to help, right? As much as possible, avoid gatherings. And it's hard, especially like if it was a month in, hey, no problem. This thing seems serious, but now we're almost a year and we're in the holiday season. And like I said before, we want that comfort of our family. And so it's just tough, right? So avoid gatherings as much as possible. Stay at home if you can. Maintain your social distance when you're out and about. Good hand hygiene. Right, one of the most important things. I know masking is extremely important as well as social distancing, but when you get anything on your hands, or COVID, the flu, the cold virus, anything, when you touch your eyes, your nose, your mouth, you eat before you wash your hands, those are things that can greatly increase that transmission, right? And mask up. It seems inconvenient, right? And especially if you've been doing it for a year, but mask up. It protects you as well as other folks. There's many types of masks out there. Some are better than others, but I can tell you, if you're using the cotton mask, if it's 2-ply, you're all set. Many people talk about how the fibers, are bigger, these are the fibers, and that the virus can go through. You're absolutely right. Someone's coughing right in your face. However, if you're just walking into an elevator that someone just had COVID and sneezed, you have a lot less chance of getting that virus if you had that mask on. And then, of course, you see everyone out and about, and you got the mask underneath the nose or hanging off their face, or it's a new headdress for them. Those, of course, don't help you as much. And then also, anytime that you adjust your mask, I adjust my mask all the time, which then makes me have to wash my hands or use hand sanitizer. A lot of people are adjusting their mask and not using hand sanitizer. And if you have got that virus on your mask, you now have it on your hands. And now we're talking about, oh, my eye itches, or I'll go a little itch on the nose, or I just ate a cheeseburger. So we're human, but try not to let your guard down and encourage others around you to do the same. This thing, like I said, R naught of 1.8, that's a big reproductive number. And you can see it spreading and surging right now. We talked about the mask. It's a barrier for respiratory droplets. Whatever's holding in the air is what it's extremely useful for. We talked about it being inconvenient. However, you're protecting yourself and your family, keeping your healthcare workers healthy so we can all enjoy the holidays and better take care of you. Protect first responders and essential workers. Keeps kids in schools and allows businesses to stay open or reopen, right? Depending on where we are in the mitigation. I read this thing on the story on social media earlier this morning, and I wish I had it in front of me, but I'll try to kind of keep it really brief, kind of a Reader's Digest version. But it talked about getting in an accident on the way to work, right? And someone runs a red light and smashes into you, you break your leg. You go to the hospital, the orthopedic surgeon's waiting there for you, takes you right to the OR, gets you fixed up. You're in for a day, maybe 2, you get out, yay, everything is great. Let's say that 10,000 people had the same accident that same day with 10,000 broken legs. Let's complicate it even more. The doctor themselves was in an accident on the way that broke their leg. So you can just see that the first scenario where you're dealing with one patient, one surgeon, one ED that's not overcrowded or surged is going to be a different outcome than if you had 10,000 of those, right? And I'm not saying there's going to be 10,000 accidents on the way to work in Centralia, but it's just kind of opens your eyes on a little bit of a story where, okay, I see what's going on. The resource is starting to get restricted. And do you want to have that car accident on the day that we didn't have a surge, or one in between? And of course, you're supposed to mentally take out car accident and put COVID, but it's the same scenario, right? And we want to make sure that we're providing the most excellent, exceptional care to everybody, that we have the resources to do it. So we need everybody's help.
So we talked about your capacity and what's going on in the community. We see a rise in numbers. We hear that you're not overwhelmed right now. Do you want to talk about worst case scenario if this continues to grow? At what point Are we getting nervous?
Unfortunately, we're there as a healthcare system. And I don't mean just SSM. I don't mean just St. Mary's or Good Sam. I mean the healthcare system of the United States. Horror stories coming out of different states. Illinois is leading the positivity rate right now in the United States. It's this past week. Like, we're there, so we are definitely surging. So worst case scenario is we do continue to peak. We're already, like I said, restricting things and talking about restricting more, right? And it's hard when it affects you. So how long is it going to be before I announce to you and the rest of the businesses in Centralia and the community that our restrictions is going back to zero? Our visitor restriction policy. It's not long, right? Because the writing is on the wall. We're much more full of seeing COVID than we did in the spring. So with that, you got to think, well, what are we doing about it? And one of those surge plans is to reduce the exposure, reduce visitors. Also, in the spring, the entire state stopped doing elective procedures. So we're working on a phased approach where we can still continue to do procedures, but starting to look at what type. So right now we're looking at electives that then result in an admission. Why? Because we want to conserve at the hospital level those inpatient rooms, those nurses, those doctors, respiratory therapists. So if we can just pull out one section of that to assist us and let us continue to operate, then that'd be great. But your worst case scenario is to continue to see that number grow and grow and grow. Alex Garza, super strong man, Dr. Alex Garza. Probably see him on TV. You've seen him in hurricanes. He works for SSM Health. He worked for FEMA. He's been on CNN. So super strong guy. He leads the St. Louis Pandemic Task Force. On Friday, very powerful video. I hope you all get a chance to go check it out. Go to KMOV, go to Facebook, whatever, and search Dr. Alex Garza Pandemic Task Force. It'll pull up 30 minutes. He actually gets choked up in the middle of it because he's begging the state of Missouri to do something about it. And he's also begging the community, wear a mask, stay socially distant. So he starts to get choked up because he has nurses and doctors there, and then they start to tell their story. And so it's extremely emotional. And just to see someone that's seen natural disasters in his entire professional career, and so smart and so strong, to be humbled and get choked up, man, I think we're there on the surge, and it's scary. It's scaring our experts. Hospitalizations being more than our capacities, worst case scenario. So right now we're capping our ICU at a certain level to make sure that we have a bed or two available when someone does come in that's kind of heading south. The lack of healthcare workers. We talked about not only them being human themselves and being positive, and having to quarantine, but what if their family does? And that pulls them out of their work, right? And we all know from someone that has had it, or an exposure, or ourselves, or whatever the case is, you're out either 10 days or 14 days, best case scenario. That's if you're feeling good. So you can quarantine. So really a strain on the resources that we have to have, which is the excellent staff and physicians that we do work with every day. Required to go on like a mandated lockdown would be extremely bad too, right? Where we would stop all surgeries. We don't want to do that. We just want to figure out what we can control and let us govern how to make this happen, to make sure we can take care of the community, and then continue down our surge plan, right? So making sure that we have enough capacity and enough workers, and what are we not doing so that we're able to do that. Best case scenario, we turn this thing around and move that surge and let it drop back down like we did in the spring. So because we did have COVID in our area, there's no doubt, in the Midwest. Chicago, of course, had the really high surge. We did not have it so much in Southern Illinois, but we need to get back to the mentality that we were, that March, April, I'm scared to death to not go outside without a mask mentality, to further decrease the exposures. And that would really be the best scenario, is to turn that positivity rate right around. And 2020, what a year, it's just like every day is like, what's going to happen today? And it's been a real challenge for everyone on the planet, but you will get through this. Like, we're really strong humans.
Well, and I think that's the positive takeaway from all of this is, yeah, we are going to get through this. Now, here's the thing we do need to talk about, which is the holidays. we now have Thanksgivings around the corner, Christmas is around the corner, New Year's, boom, 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 all these holidays that are typical for gatherings.
Yeah.
Not just your immediate family and your siblings, but then now your aunts and uncles and cousins, and it just grows so exponential. So what can we do? And I know it's don't meet with them. I mean, that's the easy answer, right? Like you just seclude yourself, stay in your home. But do you have any other thoughts or ideas as far as what we can do?
Just to enjoy family and friends and enjoy the holiday spirit. You got to do it in probably a different manner. There are tips out there, and I did want to give a website that you could actually plug in kind of your scenario, whether it's your family or extended, or I was going to church, and it's mycovidrisk.app, mycovidrisk.app. And you can actually plug in scenarios, and it'll tell you on the risk continuum where it's at, right? So if you would say, I'm going to a stranger's house and there's going to be 100 people in a 10 by 10 room, it's going to say extremely high risk, right? No one wears masks. But if you said just my immediate family sitting down to dinner, low risk, right? So depending on what you're doing, you can plug in different scenarios where you're at, and it'll actually calculate what it would be to help kind of alleviate things, or at least the risk so that you can accept it, or say, you know what, I'm good. I'll do Thanksgiving via Zoom.
And so really, I wanted to make sure that the hospital was good. It sounds like you guys have everything going. You have over 40 rooms that are safe and separated from the hospital. And then staffing is your biggest issue. Is there anything we can do to help with that? Are you looking for specific staff?
Hey, yeah, if you want to do some recruitment, that would be great, everybody. So yeah, if you know someone that is a nursing degree or respiratory therapist or lab, we're always hiring. And this time more than ever, right? The more hands on deck, the better. But like you said, we've got great people, great plans, and we just want to make sure that we have everything, all the resources, whether it's infrastructure or staffing or ventilators, the whole nine, making sure that we have that in our plan so that we are serving the community the best way we can.
Is there anything that you need right now besides staff?
Positive thoughts and prayers would be awesome. Like I said, we're doing celebrations all the time with the staff. I walked around with a couple leaders last week with a mobile coffee bar. They absolutely love that. So we'll be doing that again. I was dressed as a chef, and the cart was in fall decor. I think in a week or two, I do it again, maybe next Friday. And we'll continue to do this as long as they love it. But it had some really great stuff, and just their smiles, because they just needed a mental break.
Yeah.
And as we get closer to Christmas, maybe dressing up as Santa Claus or something, but in a sleigh, who knows? But we just got to keep mentally positive things going through, because we are human, and the stress is just overwhelming. Just overwhelming.
So is there any tips you have for mental health? You brought that up.
Yeah. So there are things out there, and a lot of it's individualized, right? So, if yours is taking a walk in Foundation Park by yourself, reading a good book by a fire, enjoying that coffee, it means different to different people. It might be, making a nice dinner, whatever the case is. And we all have these outlets, right? And we need to make sure that when it comes to those things, that we can be as normal as possible, because this whole year has been full of canceling things and staying away from people. And we can only take so much of that as human beings. The way we're made in the brain, and how we've been raised, and how we've lived our lives this whole time is not made for that. And so you've got to find these outlets. And some people are doing it virtual, like me and you doing this meeting right now and this recording. It's just to be able to see your face and your facial expressions, and you can laugh at my bad jokes and things like that. Those help me out, right? And so that helps, instead of just the phone with no video. But it is different for everybody.
Yes, it is. And so really, I want to make sure that our businesses understand what's going on and what they can do. I want to make sure that the individuals can understand what they can do. So to wrap up real quick, wear your mask, wash your hands, watch your distance. Those are the 3 rules. Other than those things, it is really just to make sure that you are paying attention to what's going on around you. Make sure, the numbers are going up right now. So taking extra precautions, being less risky in your choices, And that's the one thing I want to say to my businesses, like, you know, everything we can't tell you what to do. I get people call me and say, well, can I be open? Well, you're a business, you can make your own choices. I can't tell you to be open if the rules are that you can't. But also, you know, do what's safe for you, safe for your employees, and safe for your customers.
Yep.
And ultimately, we want you to make money. So we also want to implore the people to think outside the box a little bit. Just like Damon and I are virtual now, do online sales, figure out ways to promote what you're doing virtually or in a way that's socially distant. Think outside the box there. So Damon, I thank you for coming on and telling us what's going on locally at our hospital. Is there any other words of wisdom or anything else you would like to share?
No, just try to enjoy yourself over this holiday and just try to find your outlet for stress. Thank you so much for this. I hope you enjoyed the talk. I know this is recorded, but if you have any questions, you all have my contact info, or of course, Marcus can get a hold of me or give you my contact. So thank you, Marcus.
Thanks, Damon.
Thanks, Chamber. Bye-bye.